I know that some of you have been here for a while, but I just wanted to take this moment to welcome all of you to the Zoom conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Kimani Hendricks, Multimedia Communications Coordinator for MS Focus, and I'm joined today by Adrienne DeBerry. She'll be talking to us about the ins and outs of specialty pharmacy. And after the presentation is over, we'll allow time for questions as we want all of the participants to interact as much as possible. So without any further ado, I'll introduce the speaker. Adrienne DeBerry is a clinical pharmacist at UF Health Jacksonville and is a clinical assistant professor for the University of Florida College of Pharmacy. She received her doctorate of pharmacy in 2012. Upon graduation, she completed 2 postgraduate residency programs, the second specializing in ambulatory care. She is board certified in ambulatory care pharmacy and certified in specialty pharmacy. Her areas of practice include neurology, pain management, and specialty pharmacy. She has held leadership roles in multiple professional pharmacy organizations and is passionate about patient education. And we're pleased to have her join us to present this important topic. Adrienne, thank you for being with us, and I'll turn it over to you.
Thank you so much, Kimani, and I'm very happy to be here. Today, I want to take a little time to really dive deep into the world of specialty pharmacy, discuss some of the unique challenges associated with specialty pharmacy, and give you all some tips on how to navigate these troubled waters unscathed. I like to have interactive talks, so this talk will also be interactive. If you have a mobile device, you can text the code AD393 to the phone number 22333 to join our polls for this session. You can also join by a tablet or a computer browser, but make sure you open a different browser so you don't lose our broadcast today. And the polling feature is only active for the live broadcast and not on the recorded playback. Your standard carrier rates will apply for your text messages that are sent. The polls are completely anonymous, and I would think that it'd be good for everyone to try to participate if they have access to. So we're going to start with our first poll. Again, to join our poll, text the phone number 22333 with the code AD393 to participate in our poll. And I just wanted to find out and see how our participants were actually feeling today. Are you really in a good mood, very excited about today? Life a little bit upside down and topsy-turvy, feeling a little bit unsure, but still making it? Are you relaxing and enjoying yourself today? Are you a little bit down or under the weather? Or is life a little bit crazy for you right now? So again, if you want to join the poll, you can text the phone number 22333 with the code AD393 to participate in our poll. So far, everybody looks like they're doing pretty good. Again, there'll be more polling opportunities as we go throughout our presentation. So hang tight if you have not been able to participate in this poll. I wanted to first start with a quote that I thought was really reflective of the MS Foundation's teleconference series. It also was very relevant to myself as I was preparing this presentation. The quote is, "If you have knowledge, let others light their candles in it," by Margaret Fuller. Margaret Fuller was an American journalist and a women's rights advocate in the 1800s. And I think that this particular teleconference series does just that. It allows people to share some of their experiences and knowledge with you all so that you can go forward and apply it to your everyday life. In this comic, it actually depicts a very familiar situation that you may have observed in a pharmacy. You see a customer or a patient that is approaching the pharmacy counter and asking, "How long does it take to stick a label on a box?" The pharmacist replies, "Only a few seconds. It's making sure the medicine doesn't kill you that takes a bit longer." This particular situation is very common from a pharmacy perspective, but today I want to shed some light on some of those things that happen in between you dropping off your prescription or your provider sending the prescription to the pharmacy and you receiving your medication. When most people hear the word pharmacy or pharmacist, they think of a retail shop where you see the pharmacist in their white coat behind the counter, flanked by multiple different concoctions and potions that are used to treat your ailments. However, this imagery does not accurately reflect the full details of the current profession of pharmacy. It really only reflects a portion. So when you think of this imagery, I really want you to think of it more as the traditional retail pharmacy experience. Retail pharmacy specifically refers to a dispensing pharmacy operation that directly interfaces with the patients who are receiving their medications. There are various types of retail pharmacies, including mail order, home health and infusion pharmacies, as well as the practice of specialty pharmacy. Specialty pharmacy can actually encompass some of those other types of retail pharmacies I mentioned. When we look at the view of the pharmacist, I want to separate it out into kind of two different categories. The traditional view of an outpatient pharmacist, or a pharmacist who works beyond the hospital, or for patients who are not currently admitted to a hospital. All pharmacists have to complete a doctorate of pharmacy program in order to practice pharmacy. This incorporates the undergraduate degree training as well as their graduate degree training, also known as their PharmD program. So overall, pharmacists may have 6 to 8 years of training in order to receive their as well. Forward to today, where we have a lot of different things in our profession that have changed. Not only do our pharmacists all have a doctorate of pharmacy degrees as part of becoming licensed, pharmacists are also seeking additional training through residencies. Residencies are also known as postgraduate year trainings and typically last 1 year. Some may be lasting 2 years. For the first year, they may undergo a general residency where they're doing mainly inpatient-focused work and rotating through different areas of the hospital, such as internal medicine, critical care, cardiology, staffing the hospital-based pharmacy as well. For PGY2s or second-year residencies, those tend to be more specialized and concentrated. Now, across all residencies, the pharmacist will still be a practicing pharmacist, and they have to participate in clinical activities and training as well as research. Pharmacists also have the option of pursuing fellowships, which tend to be more research-heavy based. So in addition to residency training, which may be an additional 1 to 2 years, they still have their baseline pharmacy doctorate training. So these pharmacists may be having up to 10 years of training once they've completed these programs. Any pharmacist can also choose to pursue a board certification. Now, there's different areas you can become a board certified pharmacist in. You may see some of that alphabet soup behind different pharmacist names, letters such as BCACP, BCPS. Those all mean something, that these pharmacists have undergone intensive training and education, as well as had to sit for a board exam in order to become board certified in these specific areas. And these exams are not something that the pharmacist can just take at home. They're very formal. You have to go to a testing center, and they may last several hours. So these are not something that would be taken lightly to pursue. Pharmacists are also specializing in specialty disease states and participating in more activities right alongside the shoulders of the prescribers. So there's something called collaborative practice agreements that are agreements between a clinical pharmacist and a prescriber, usually a physician, that allows the clinical pharmacist to participate in direct patient care activities that the prescriber deems appropriate. So, for example, patients may be seeing a pharmacist for chronic pain management and going face-to-face for visits with them at the clinic. When we think about medications, there's different types of medications. The first category would be over-the-counter medications. These are medicines that you can find at any retailer and purchase without a prescription. Now, sometimes some states may put in restrictions for some of these over-the-counter products, meaning that you may have to show your driver's license or you may have to be a certain age before the product will be sold to you. For example, pseudoephedrine. Pseudoephedrine in many states has restrictions in which limit the quantity of pseudoephedrine that can be purchased. Now, why is that, you ask? Pseudoephedrine is a medication that is used for nasal decongestion. So why would you want to limit that? That medication is also one of the ingredients that can be manipulated to make methamphetamine, or also known as the street drug meth. So in an effort to try to preserve some of the safety of the public as well as safety for you utilizing the prescription, some of those limits have been put in place for over-the-counter products. When we think about prescription medications, these are known as legend drugs. And with these legend drugs, you would have to have a prescriber submit some type of authorization via prescription for you to receive those products. Those can be further broken down into specialty medications and non-specialty medications. So our focus today will be what are specialty medications? What exactly makes a specialty medication special? So if you still have your mobile device ready and handy, get ready for our next poll. If you've just joined us in the presentation, you can text the phone number 22333 with the code AD393 if you would like to join our active poll. So what exactly makes a specialty medication special? Is it the medication is a pain in the neck to get? Does it cost over $5,000 for the treatment? Is the medication something that's not sold everywhere or hard to find? Or does the medication have lots of side effects associated with it? So it looks like we have a couple participants that have answered. And just so you all know, there's actually no standard definition of specialty medications. However, drugs in this category do share some specific characteristics. Specialty medications are medicines that are often found to carry these 4 characteristics. So they may be used to treat a rare or complex health condition. They may have a high safety risk profile, may include complex administration or handling, or have a very, very high cost associated with their use. And last but not least, it may just be because your insurance says it should be a specialty medication. Here's a listing of some examples of disease states that are associated with specialty medications more times than not. Multiple sclerosis is one of those areas where you will find a great number of treatment options that are classified treatments and even chronic liver disease treatment. Now, safety risks usually play a big role in determining whether or not something should be considered a specialty medication. Clinical trials give us insight into the drug side effects and risks that may be presented to patients who are using these products. Now, there's different phases of clinical studies, phases 1 through 4, with phases 1 through 3 being the most significant as part of the FDA approval process. So when you hear on TV that there was a phase 3 medication that was recently approved that helps cut MS relapses in half, that's what they're referring to, these clinical research studies that are being conducted. Now, in those clinical studies, the researchers are very selective about which patients are included. They have a listing of what's known as exclusion factors, and a lot of times those exclusion factors may be based on some other conditions that the patient may have. So, for example, a trial may decide to exclude diabetes patients or people who are beyond a certain age from participating in those studies. Phase 4 studies are considered what's called post-marketing trials, and that actually is studies looking at what happens to the patients who are on the medication once the drug is released to the general population. So really, those FDA approval studies don't necessarily always give us the total picture of what happens when a medication is released to the general public. With that being said, the FDA sometimes can put in place caveats for high-risk medications once they are FDA approved. So an example of that is a REMS program. So REMS stands for Risk Evaluation and Mitigation Strategy. So for our next poll, I'm asking you all, what do you think a REMS program is? Is it a requirement for all FDA-approved drugs to keep patients safe? Is it a program created by pharmacies to help keep patients safe? Is it a program created specifically by clinics to help keep patients safe? Or is it a program created by the FDA for some drugs to keep the patient safe? Or E, none of the above? So it looks like we've got some very smart participants in our audience today. So a REMS program is a drug safety program in which the US FDA can require for certain medications with serious safety concerns to help ensure the benefits of the medication outweigh its risks. A good example of a REMS program that some of you all may be familiar with is with the product Lemtrada. Lemtrada is a disease-modifying therapy that's used to treat multiple sclerosis. Now, Lemtrada comes with a lot of guidelines and recommendations for safe use. Particularly as part of the REMS program, the FDA has put in place principles called Elements to Assure Safe Use. This outlines some of the responsibilities of the prescriber, as well as the patient and the dispensing specialty pharmacy on how to handle these particular products and patients that are prescribed these agents. So with respect to Lemtrada, prescribers must do a number of things before they can prescribe the therapy to a patient. They must first become certified through the Lemtrada manufacturer. This involves training and signature on different documents to assert that they've completed the appropriate training and are aware of some of the risks and benefits associated with prescribing Lemtrada to patients. In addition, the prescribers also have to continue to monitor patients, ordering specific labs and monitoring for any side effects or adverse events that may happen for patients who are on this particular drug. For patient responsibilities, the patients on Lemtrada have to make sure that they are getting their skin exams prior to starting the therapy, as this particular medication can increase risk of skin lesions and skin abnormalities. So with respect to the REMS program, patients also must be enrolled in the Lemtrada program as well. So there are multiple forms that they have to fill out, as well as receive specific education on the risk and benefits of using this medication and some of the side effects that they need to look out for. At our institution, we have 2 pharmacists in our clinic, myself and my partner, provide education for these patients who are on Lemtrada, and we're also started on any new other disease-modifying therapy just to make sure that they understand the risks and benefits associated with the treatments. Patients must also undergo specific lab testing and monitoring during and after their treatment. Particularly with this drug, patients will be monitored for months on end after they've received the medication, so it's important that they're aware of how important some of these monitoring parameters are. For pharmacies who are dispensing this product, specialty pharmacy also has to be enrolled in the REMS program and undergo training to making sure that they understand how to safely handle this particular drug product and patients who are on this treatment, as well as designating an authorized representative. That authorized representative basically acts as the point of contact between the Lemtrada manufacturer team and the specialty pharmacy as well as the patient. The pharmacies must also verify that the prescriber is authorized and certified to be writing prescriptions and orders for Lemtrada. Another example of a specialty medication that has one of these relevant characteristics is Mayzent. So Mayzent is a disease-modifying therapy that requires a number of precepting lab work and tests to be done before a patient can start this particular treatment. So patients who are being considered or starting on Mayzent must first have an eye exam to check for the risk of macular edema. This is important because Mayzent can potentially increase the risk of developing macular edema. So we want to make sure that any patient that we put on this therapy is appropriately screened out and making sure they're safe for using the product. Another test that the patients will undergo is getting an EKG and checking their heart rhythms and making sure that there's no abnormalities. Again, this is to help ensure that the patients we're placing on therapy are the right patients for the right drug. Lab work such as testing your white blood cell count through your complete blood cell count panel, looking at how well your liver is functioning, as well as testing for any immunity to varicella zoster is also important before starting this treatment. Now, something that's a little bit different and unexpected for the most part for some people for this particular medication is you actually have to undergo genetic testing prior to starting Mayzent. Now, the reason you have to undergo genetic testing is that they found that patients with certain genetic markers actually process the medication a little bit differently and will have to have a reduced number of doses or reduced milligrams for use of the drug while they're on the treatment. So as you can see, there's extensive testing and processes for ruling out someone who would have bad outcomes on a medication before they even start their medicine. Mavenclad is another disease-modifying therapy that is a specialty medication, and I wanted to highlight some of the complex dosing that's associated with this particular product. So this product is a weight-based therapy, so each patient's dosing is going to be different from one patient to the next based off of their weight. It also involves multiple treatment courses, and these treatment courses are separated by 43 weeks at a minimum. For each treatment course, you have to undergo 2 cycles of treatment, and these cycles will last for about 4 to 5 days per cycle. Now, Mavenclad only comes in a 10 milligram dose. So based off of the patient's weight and the treatment cycles and the timing, the patients will have to take multiple tablets according to their weight and for different times on different days. So it can be quite messy when trying to figure out what the exact dosing for one patient will be. Now, this next slide is an example of how we determine the actual doses for the treatment cycle for each patient. So as you can see, it's a lot to take into consideration for this one drug, and that's only with respect to dosing. That doesn't include some of the side effects or any other things associated with it. Mavenclad is also a good example of a specialty drug that requires very specific handling. Now, this particular medication is considered to be cytotoxic, meaning it can cause damage to cells if used improperly. It's listed as an OSHA hazardous drug for handling, and it has very specific delivery and shipping requirements as a result. When we're counseling our patients, we want to make sure that they understand to wash their hands after giving themselves their dose, making sure to keep the product safe from any pets or children accidentally getting into the medication, because we don't want any accidental harm coming to someone or pet who's gotten into the medication and it's not intended for use in them. Now, an example of a drug that is a high-cost specialty product is Zolgensma. So this particular medication is a product that's used for spinal muscular atrophy patients. Now, it comes with a very high price tag. The cost of treatment is about $2 million. You may have heard about this medication on different television programs or news stories. It's one of the most expensive specialty products that's available. Now, this particular therapy is actually a gene therapy. So what it does is it helps kind of replace or repair some of the faulty genes associated with some of the muscular symptoms that these spinal muscular atrophy patients have. Now, with that being said, gene therapies are very expensive and take a lot of time and resources to develop. So it makes sense that this would correlate to a very high price tag for this particular product. But not only is it related to the features of the drug cost and the side effect profile, but sometimes specialty medications can be deemed so just because your insurance chooses it to be. So your insurance company has a listing of medications called the Formulary, which includes a listing of drugs that they will consider paying for. Now, these drug formularies are stratified into tiers, almost like the tiers of a cake. The higher the tier usually means the higher the cost of the medication. Now, not all drug plans will list the same drug in the same tier. So, for example, insurance company A may list drug XYZ as a tier 4, whereas insurance company B may list drug XYZ as a tier 5. Specialty medications usually fall into the higher tier categories and oftentimes require something called a prior authorization. So get ready for our next poll. Have you ever had experience or had a medication that required a prior authorization? You can check A for yes, B for no, or C for I am not sure. So we've got a couple of responses that yes, they have had a medication that requires a prior authorization. Now, sometimes prior authorizations can be quite frustrating for both the patients, the pharmacy staff, and the prescriber. So what exactly is a prior authorization? A prior authorization is a process by which insurance companies require the prescriber to provide them with certain documents for review in order to determine if the insurance company will be willing to pay for the medication. Now, prior authorizations include lots of questions from the insurance company to your prescriber. These questions may include what medications has the patient tried in the past? Has the patient tried a medication that's listed on the formulary as a preferred agent or a lower tiered agent? What is the age of the patient? There are some FDA-approved products that have age restrictions. So the insurance company wants to make sure that if those medications are being prescribed, that they're prescribed to the patient who has the appropriate age. Is this a new treatment or something that the patient has been on before? If a patient has been on this medication before, the insurance company may ask additional questions such as, have they shown any clinical improvement with using the treatment? So, for example, if you're looking at a prior authorization for Empira, an insurance company may ask, has the patient shown any improvement in their timed 25-foot walk test? The prescriber will then have to submit clinical notes documenting some of these answers, or may be able to complete the prior authorization electronically. Prior authorizations may also involve asking, what are the patient's recent labs? As I mentioned before, some of these specialty products can have some side effects for affecting the patient's kidney function, affecting their liver function. So the insurance company also wants to make sure that if they do cover this medication, that it doesn't cause any additional harm to the patient. So So up until now, we've talked more about pharmacy-specific aspects of the specialty pharmacy world. But what about some of the pharmacy-specific aspects? So with specialty pharmacies, there's a lot of things that they have to take into consideration. So on the specialty pharmacy side, we have to consider, do we have access to the medication? Should our specialty pharmacy become an accredited organization? What insurance plans are we able to dispense specialty products for? As well as looking at our staffing and personnel. Are there any additional training or staffing adjustments that we need to make to dispense these medications? Specifically looking at the drug access and ordering. When you think of how traditional pharmacies operate, they normally order their drug products from their supply vendor or their medication wholesaler or vendor. So these specialty pharmacies would operate under the same process. However, some medications that are deemed specialty are not available to every pharmacy. These are called limited distribution drugs. Now, these limited distribution drugs are more of like a VIP list of access. So for a drug company to decide that they want their product to be limited distribution, it means that they would first have to grant approval for a pharmacy in order to receive the medications. So with these limited distribution drugs, pharmacies may have to enter a contract with the manufacturer or submit specific reporting items to them to prove how they're doing with their quality measures, just to make sure that the drug manufacturer approves them on their list. Specialty pharmacies also have to take into account drug shortages. So with the recent coronavirus pandemic, there was a lot of talk about hydroxychloroquine. Now, hydroxychloroquine is a prescription product that's used a lot in rheumatoid arthritis patients. So our rheumatology patients who are normally receiving these products all of a sudden had a huge increase in demand for the drug, and some pharmacies had challenges of securing the product for their normal clientele. For pharmacies who are certified by different drug manufacturers as part of REMS programs, depending on how complicated the REMS program is, it may take a little bit of time for them to access those drugs. Specialty pharmacies also have to take into consideration billing capabilities. So just because you're receiving a medicine or a prescription product, it doesn't necessarily mean it's always being billed to your pharmacy benefit part of your insurance plan. So there are some pharmacies that are capable of billing both the medical benefit and the pharmacy benefit. So that is something that a specialty pharmacy will have to make sure is being done appropriately on the back end when they're dispensing some of these medications. You also have to take into consideration the ancillary supplies associated with administering the drug. So there are some specialty products that may require syringes, needles, tourniquets, alcohol pads, different accessories to be used for self-administration of these products. So the specialty pharmacies also have to take that into account when they're distributing these medications. There's also onboarding and training from the manufacturers. So specialty pharmacies may be interfacing with drug sales reps or medical science liaisons from pharmaceutical companies in order to be onboarded or be able to dispense these products. Now back to limited distribution drugs. Now in the world of multiple sclerosis, there are a number of drugs that are considered limited distribution drugs. So for some of you out there, you may have been prescribed these products and the orders may have been sent to a specific pharmacy, and you later found out that the pharmacy is not able to supply you with those medications. Sometimes it's because it's a limited distribution drug and the pharmacy just does not have access to the product. Now, when we think about specialty pharmacy accreditations, these are basically symbols of quality of the pharmacy. Pharmacies can choose to pursue an accreditation which almost acts like a seal of approval from the accrediting body. pharmacies must first submit an application to become a candidate for accreditation, and this is something that can be pursued by any type of pharmacy. So it could be a pharmacy associated with a hospital or health system or a large academic medical center. It could be a retail chain pharmacy, or it could be an independent pharmacy. And there are a number of accrediting bodies that exist for these specialty pharmacies to pursue accreditation through, and all of them have some generalities that are the same, but there are also some things that are different. Now, in order for a specialty pharmacy to become accredited through one of those organizations, the accrediting body has to look at a number of quality measures and data points for the specialty pharmacy. So the accrediting body is looking at things like the specialty pharmacy's call center stats. Are they checking on their patients who need lab work and making sure that that lab work for the specialty medication is being completed in a timely fashion? What about medication adherence? Are they making sure that the patients are getting their refills on time and are never without their medication? The accrediting body may also look at some of the delivery statistics. Are they getting the drugs to the patient to the right location? Are they shipping any hazardous materials in a safe manner? As well as assessing how well the specialty pharmacy is doing with providers. So they may look at any questionnaires or satisfaction surveys that the specialty pharmacy sends to the patients as well as to the prescribers. And of course, we also want to make sure that those specialty pharmacies are not having a large increase in any medication errors. So these accrediting bodies will also take into account how is the specialty pharmacy handling any reported side effects or adverse events? Are they doing any quality improvement projects to make sure that they're always operating at top notch? So as you can see, there's a lot that goes into accreditation. One of the things that specialty pharmacies also have to think about is, are we in the network for the insurance plan? So the insurance plan can deem which pharmacies that they will allow their patients to fill medications at. And a lot of times it's based off of some of those quality metrics. So specialty pharmacy accreditation sounds like an awesome idea to pursue, but there are pros and cons associated with seeking a specialty pharmacy accreditation. So a specialty pharmacy can gain more access to insurance networks, as some insurances require you to be accredited by URAC or ACHC in order to dispense products to their patients. They also may gain expanded access to limited distribution drugs from various drug manufacturers. Specialty pharmacies also use accreditations to kind of set themselves apart from their competitors. It basically gives them a high seal of approval and signifies that they're operating at top-notch quality standards. Now, there are some cons associated with pursuing specialty accreditation. So it's very time and resource intensive and a large financial investment. So sometimes some of the smaller independent pharmacies may not have the resources to pursue an accreditation. There may also be additional software support requirements to keep up with all of the data metrics and ensuring your pharmacy continues to operate at quality standards. And with each renewal cycle of accreditation, those standards may change. So it may get increasingly difficult to continue to maintain those high quality standards if they are constantly changing. So when we look at personnel and staffing, especially the pharmacy always wants to make sure that they have the appropriate staff in the right place, that they've received adequate training for dispensing the medication safely and effectively to the patient. Now, there are certifications that pharmacy staff can pursue as well. So pharmacy technicians can actually choose to become certified pharmacy technicians, signified as the CPHT credentials, as well as specialty pharmacists can choose to pursue the CSP credential. So this signifies that they've had advanced training in some of the specialty areas in dispensing specialty products. You have to also take into account some of your policies and procedures and making sure that they align with accreditation standards. And it really is an all hands on deck approach. There's a large collaboration between IT consultants or IT teams for institutions, call centers, the pharmacy staff, marketing, legal teams, you name it, they're probably involved in the process. So I know I've gone over quite a bit of information. So are you guys feeling like you're stuck in the specialty pharmacy matrix yet? Well, hopefully with the next few slides, I'll be able to give you some tips to successfully navigate the world of the specialty pharmacy matrix. So tip number 1, know your formulary. I cannot stress this enough. I tell this to all of my patients. Know what's on your formulary. Now, your formulary is a listing of medications that your insurance will cover. So think of it like a restaurant menu. Now, your prescribers may not have that information readily available during your visit. So it's good for you to know how to access it or have a general idea of what your formulary encompasses. High-cost medications, again, tend to be the higher tiers on those drug formularies. And just because it's on your formulary does not necessarily mean it won't require a prior authorization. There are some formulary items that still require prior authorization or may have quantity limits in place. So where do you find your formulary? The easiest place to find it is usually your insurance plan's website. They oftentimes have a section that's labeled Pharmacy Formulary or Search for Covered Drugs, and this is where you would find information of a listing of drugs that they would be willing to cover. You can also call your prescription drug plan to find out when in doubt. There are also some online tools and mobile apps that you can utilize in a pinch. I do like to use Coverage Search app myself, just to look for any formulary questions or drugs that are on formulary while I'm in clinic and for patients. It's very easy to use. You can just type in your state, your plan type, and then the drug name, and it shows whether or not the drug is covered. And what's nice about that app too is it also shows you covered alternatives. So medications that may be used in the same class or similar for the same disease condition that your insurance is willing to pay for as an alternative if the drug you're searching for is not covered. And tip number 2, see if you qualify for copay assistance. Now, copay assistance is something that is designed for commercially insured patients by the drug manufacturer. So drug manufacturers will help patients with commercial insurance cover some of those copay costs. You can always just go to the brand name drug site and see if there's a copay assistance program that's active and on file, or call the drug manufacturer to see if you qualify. Now, government prescription plan patients are excluded for most of these manufacturer copay assistance programs. So there is an application process associated with any manufacturer copay assistance program. You can usually complete it by phone, but there may be some paperwork that has to be submitted directly to the company. And it helps a great deal for those patients that have commercial prescription insurance. Some programs provide patients with a prepaid credit card to cover some of the copay costs. Now, these prepaid credit cards, as part of copay assistance programs, only cover that specific drug and for the copayment. So you can't use that prepaid card to go and buy shoes at a retail store. There's also some components that happen on the back end and the specialty pharmacy side where we're entering different codes that allow you to utilize some of those discounts on the copay assistance programs. Tip number 3, see if you qualify for a patient assistance program. Now, this is also something that's put in place by the drug manufacturer or pharmaceutical company. However, it's a little bit different. Patient assistance programs provide free drugs to patients who meet certain criteria. So the patients have to be eligible and meet the criteria and submit an application in order to be considered for these patient assistance programs. Now, these come in handy for patients that are underinsured or uninsured as well. Sometimes there are financial documents that may be required with the application, and different components may vary from program to program, so make sure you read those applications very carefully. The processing times also may vary from company to company, so please keep that in mind if you are signing up for a patient assistance program. But these are really helpful in operating as a safety net for patients to ensure that they can still receive much needed treatment. A great example of a resource that I recommend to our patients is needymeds.org. It is a free online database and has a wealth of information to help patients get their medication. So, for example, they have listings of copay assistance programs. You can search for your specific drug and it can bring up any copay assistance programs that are currently active for that particular medication. In addition, it has resources that you can look by disease state and find free and low-cost medical clinics as well in your area. Tip number 4 would be to utilize any charitable foundations that are out there to help with some of the copays or premiums you may have. Sometimes these have disease state specific funds, so there may be funds specifically earmarked for multiple sclerosis patients that are available. This also requires an application, and candidates must meet those application requirements in order to receive the assistance. A good thing about these is Medicare patients can apply for these assistance through foundations. Now, it's limited to a first come, first served basis. So once the money kind of runs out for those particular charitable funds, sometimes they're renewed, sometimes they're not. Just varies, but sign up as soon as possible when you think you may be in need. And some examples of these foundations or programs where you can find these foundations would be the Patient Assistance Network, the Patient Advocate Foundation, or the Good Days program. A great example of almost like the Google search of charitable foundations is something called Fund Finder that's operated by the Patient Assistance Network. So you can go on their website and enter in your particular disease state, and it will show you a listing of available foundation and support programs to help with copays as well as premium, and in some cases, travel funding. So you'll see on the left-hand side, it has a listing of the particular programs that are in existence, and on the right-hand side, it shows you a little lock symbol. So that lock symbol, when it's green, it shows you that there is open funding available for new applicants to receive. The red lock signifies that the funding is closed and they're not accepting any new applications. Tip number 5, maximize any manufacturer support services that are available. A lot of times these are listed on the drug manufacturer website and include a variety of services such as injection training or 24/7 access to nurses. But what happens if you don't have insurance? I know with the coronavirus pandemic, there may be people who've had transitions in their job and may find themselves without insurance currently, and they need to stay on their much needed specialty medication. So how are they to do that? There are ways to continue to receive your medicines. So for specialty medications, first and foremost, I usually recommend go to the drug website. There's usually a financial assistance support line that you can contact, and they'll go through a screening process and see if you qualify for any programs that they have available. You can also choose to contact a foundation for existence. So any of those foundations I previously mentioned would be of a good use. For non-specialty medications, there's also ways to ensure you continue to receive those if you don't have insurance as well. I usually recommend patients start at needymeds.org. Again, this is a free online service. You can search by your drug name and find out all programs available for you to continue to receive that medication. There's also drug discount programs. So drug discount programs, or you may hear them called drug coupon cards or coupon programs, provide a reduced cost to the patient compared to the cash price for the particular medication. A great resource is GoodRx. They have a website as well as an app, and you can type in your zip code as well as the medication that was prescribed to you and the quantity, and you can see the listing of the prices, approximations at retailers that are near you, as well as any coupons that are open from goodrx.com, and you can use those to receive your medication. There's also retail pharmacy discount programs. So there are some chain pharmacies that have large-scale programs in place that may provide medications, for example, for $4, or antibiotics may be free, or they may provide low-cost drugs for 30 and 90-day supplies for patients. Now, most of those programs use something similar to a formulary or have a drug listing of what they will include. And sometimes those retail pharmacy discount programs may have an annual fee associated. It just varies by program to program. You can use that listing of discount drugs to collaborate with your prescriber to find medications that are comparable to the ones you're on, or maybe the same ones you're on, to make it more affordable for you to receive those prescriptions. And also, when in doubt, ask your specialty pharmacy team. They have a wealth of knowledge and may be able to point you in the right direction. So in summary, the specialty pharmacy world can be quite complex, but it doesn't have to be. There are a number of resources and tools that are available to help patients safely navigate the world of specialty pharmacy. So hopefully I've been able to give you a couple of those tools to help you in your day-to-day life going forward. And your specialty pharmacy team is expertly trained, and we're always here to help. So feel free to reach out when in doubt. And that concludes my presentation for today. And thank you so much to the MS Foundation for having me. And I guess we'll open it up to questions.
For the participants, if you have a question, there is an option, more, and you should see raise hand. And that way we can unmute your microphone when we see your hand raised. A few slides back, Adrienne, you were talking about how to check your formulary, but you mentioned an app. I missed what the app was called.
So there was two apps. There's one called Fingertip Formulary and one called Coverage Search. Coverage Search is probably the easier one to navigate. But it has a listing of the particular regions and plans. I can actually pull it back up for you if you'd like to see kind of what that looks like. See if I can get it to show up for you guys. So Coverage Search is available through the Apple App Store as well. I'm not sure about Android, but I'm sure it's probably there. But it's very easy to download and navigate. You just put in your state, search for your insurance plan, and then search for the drug in question, and it'll tell you whether or not it's covered or not covered. And if it is not covered, it will show you any covered alternatives that are in the same drug class or similar drug class.
So it looks like in our chat we have people thanking you and saying that you provided a lot of useful information to them.
Oh, I'm happy to. This is the highlight of what I do, is helping people.
Casey, do you have anything to add?
I actually do, but for some reason I don't have the raised hand button on my screen. If anybody else is having a problem with that and you have a question, go ahead and put it in chat. But yes, I did have a question earlier from that caller I mentioned who was only able to stay for the first part because of a conflict. And she had said to me, I was hoping to get some guidance to help with this problem. I have been having trouble with CVS Caremark every 3 months or so. Big problems, so that I only get my Copaxone in time by spending literally 2 to 3 hours on the phone. The reasons vary, but deal with insurance, which has never changed, copay, which I don't have, and related items. Any advice on how to handle this situation?
So my advice would be to try to have a conversation with the insurance company and see if there's been any communication from the pharmacy regarding changes in formulary status or if there's been any billing issues. Now, I have had patients run into the problem with Copaxone brand versus generic, and sometimes there's been challenges from the pharmacy side with selecting the correct something called the NDC, which means the specific drug item that the insurance will cover. But also, when in doubt, see if you can transition to a different specialty pharmacy if your insurance will allow it. Because if you're having that many problems with access to your medication, that can be a headache in itself. And if there's another pharmacy that may be able to assist you better, it may be worthwhile in transitioning to that particular pharmacy.
How frequently is that an option, Dr. DeBerry? Do insurance companies generally allow more than one specialty pharmacy under a plan?
Sometimes. So in the event that your insurance company has restrictions in place to where it locks it down to one particular pharmacy, you can discuss some of those challenges that you've had and request if they would grant you an override to fill it somewhere else. That is something that is atypical or rare that would happen, but that is an option available that your insurance company may allow you to fill it somewhere else by granting an override.
Thank you so much for that. We have another question in chat, Kimani, if you want to read that one.
I don't even see the question you're referring to, Casey.
Okay, let's see. It says, is there any work going on to get Medicare to allow patients to use the pharmaceutical company's copay assistance programs?
So by law, there are certain discounts that Medicare recipients already receive under their drug plan. So for them to participate in a manufacturer copay assistance program, it actually violates that law. So no, there's no changes to that in the foreseeable future. But again, there are those foundations out there that can help those Medicare recipients get some assistance with their copays.
And which site was it again that had the foundation finder?
Yes, so you can go to fundfinder.the Foundation or the Patient Assistant Network Foundation. I will pull it back up. If you even, you can just Google not Fund Finder, but Fund Finder. Pull it back up for you all. Here we are. So Fund Finder is the one that operates kind of like a Google search. It's free to sign up for. You do have to log in. You just have to submit your email to the website and log in. But the thing I like about Fund Finder is it's very fluid because it will show you if the foundation has dollars that are actively open to be received. Versus sometimes there are resources that may have old information. This is refreshed very regularly. As you can see, there's a date and a timestamp for every search you do.
That's a terrific resource. Thank you so much.
Mm-hmm.
I don't think that Veronica's question was asked. She is looking in the App Store for the name of the app that you mentioned earlier.
So it's titled Coverage Search, and the way that you know you have it is it has a little symbol kind of listed here that looks like a fancy paperclip, two fancy paper clips, but it's titled Coverage Search in the Apple App Store.
Thank you. I would like to thank everyone for their time today. The next Zoom conference will be Tuesday, May 12th at 4 p.m. Eastern Time with Dr. Theodore Brown, who will discuss exercise with MS, keeping fit at home. Be sure to follow the Multiple Sclerosis Foundation on Facebook, Twitter, Instagram, and subscribe to the YouTube channel as well, as all future Zoom meetings and teleconferences will be available there. I want to again thank you all for your participation and attention, and especially to you, Adrienne. We thank you so much for taking the time to cover this important topic.
Oh, you're very welcome. Thank you guys for having me.
With that, I hope that you all remain safe and well during these times and beyond. Take care.